Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Hyperprolactinemia. We are looking at what are the drugs which are causing it. So in hyperprolactinemia, that includes the dopamine receptor blockers. So there's dopamine receptor blockers. So under this dopamine receptor blockers, there is atypical antipsychotics. So under atypical antipsychotics, it includes the risperidone. So atypical antipsychotics, there's risperidone. Then when you look at the phenothiazides, so under phenothiazine, what do we have? There is chlorpromazine as well as the perfenazine. So there is chlorpromazine as well as the perfenazine. Next is the butyrophenones. So under butyrophenones, there is presence of haloperidol. So there is haloperidol, and there is also the dopamine receptor blockers, the thioxanthines. There is thioxanthines and the metoclopramide. There is metoclopramide. Next is the dopamine synthesis inhibitors. So we saw the receptor blockers, now synthesis inhibitor. So dopamine synthesis inhibitor, it contains alpha methyl dopa. Then the catecholamine depleters. So catecholamine depleters includes the reserpine. Then the other drugs causing hyperprolactinemia, it includes the opiates, the H2 antagonist. So H2 antagonist, it includes the cimetidine as well as the ranitidine. Then there is the imipramines. So under imipramines, there it includes the amitriptyline. So all these are causes of the hyperprolactinemia. So it can be due to cimetidine or the ranitidine. Then there is imipramine. Imipramine we finished. So in imipramine, the cimetidine and ranitidine are actually a part of the H2 antagonist. Now when you look at imipramine, there is amitriptyline and there is amitriptyline as well as the amoxapine. So imipramine, there is amoxapine as well as amitriptyline. H2 antagonist is where the cimetidine and ranitidine are there. Then we look at the SRIs, that is the serotonin reuptake inhibitors. That includes the fluoxetine. Then comes the calcium channel blockers. So calcium channel blockers, it includes the verapamil. So there is verapamil. And then there is also presence of the estrogen as well as the thyrotropin releasing hormone. Thyrotropin releasing hormone. To learn and grow daily like this, please do subscribe. Bye.